I went to a doctor because sex was painful to me. And she just told me, like, I wasn't turned on enough.
What?
Is that not true?
That's not
Jake's
true.
like,
No.
ouch! Okay, that's what I'm wondering now. Like, maybe it's.
No,
Who are these
totally.
doctors?
Totally
Wow.
way more to
Time
go.
for a new
Because
doctor.
it could not even just be pelvic, it could be other stuff.
Yeah. There's so
Definitely
much
time
more
for a
than
doctor.
doctor.
Okay.
So-
So I probably have a tight pelvic floor.
Could be, and it could just be like, yeah, so that, there's other things that come into play there, like different psychological factors that can affect it. Not like, it's nothing that you like control, but it's just some things that could be affecting it, but that's totally real and common, very common.
They did ask me if I was sexually abused.
It's a
It
factor.
could be scar tissue, right?
Mhm.
From different things.
Yeah, sexual abuse is one of like the first things that can lead to it, so.
Because this is also maybe TMI. I noticed like right after I had a kid, it was painful, but then like after a few months, it like kind of went away. Is that because it was maybe related to the pelvic floor or?
Yeah, just healing.
Or just
Yeah,
healing?
healing, pelvic floor. That was,
Body
that was
just
kind
went
of
through a
what
very
comes to mind as
traumatic
compliment.
experience.
Yeah, it's like, I like go through this rant where people are like, all right, we're gonna go scope your knee, and we do this little tiny surgery. Like, okay, go to PT, and then we have these amazing moms who have this like crazy traumatic experience to their pelvic floor or their abdominal wall where it's literally cut open and there's no PT for it.
Seriously,
No-
they're
no
like,
PT
6 weeks,
recommended.
okay, bye. Like,
Yeah.
good luck.
At 6 weeks, you're good to go. It's like, okay,
Have
hold
a
up.
C-section and walk like this.
Right.
Oh man, yeah. So sorry, that's another rant that I go on. But yeah,
Don't worry about it.
So the only
All the
time I
preaching.
get pelvic pain is when I'm doing like some kind of plank exercises that requires like twisting like the cord. Is that the right kind of pelvic pain, or
it could be. Yeah, is you mind sharing where you feeling it?
just like the
Yeah.
Lower.
So that could
Below the
definitely
belly.
be a factor.
So I
It
can't,
could be
like-
coming from pelvic floor. It could
Yeah,
be coming.
I can't do those twisting motions because it just
Some pain
cramps up
there.
really really tight.
Yeah.
It's
Yeah.
really weird. Like, is there a way to fix that, or?
Progression.
Yeah, there would be, would want to definitely like dive in and figure out is where it's coming from, and then figure out if there's anything we need to work on mobility wise, and then gradually expose things and introduce things to it. So, that leads into kind of the last phase of this all is gradual progression. A lot of people just avoid things altogether, and it doesn't lead to any adaptations or changes due to increased tolerance. You're good. Thanks for coming.
There we go.
All I'm gonna think about now.
We're gonna talk about it next Tuesday, 5:30.
Yeah, so gradual progression, not completely avoiding things. So I wrote on their example progression of working into like double under jump ropes, but it would be something as simple as like starting with like a small step up, working up to like heel slams, and then getting to the point where you can do a single jump, all while training these other things, keeping those other things in mind, like
What's
just
a
breathing
penguin
help
hop?
you. What was that?
What's a penguin hop?
Oh.
Just. Oh, okay. So one of the things they try to train you to do to be able to do double unders.
Yeah,
Got it.
yeah,
So back on the other, I have one more question.
yeah.
So I can do sit-ups all day long if my feet are like this. But if you go into the partner sit-ups where you have to like put your feet around like this, you're kind of opening your legs a little bit. What does that have to do? Because that's when I hit like 10 to 15 with a partner sit-up.
Mhm.
That's when I can feel it. But it was only after I had the allergic reaction to the vaccine and my lungs were bad. So like I basically couldn't breathe anyway. But then putting your legs like that, I think it's the legs, isn't it?
It could be, is your breathing changing during it, but you're also changing the length of your pelvic floor in that position.
Yeah.
So here versus here,
Yeah.
changing the length. So that would maybe something like maybe you need to look at your breathing strategies there, or look at get a feel for what your pelvic floor is doing in that position and training more in that position. Kind of have to look at that
Like
further.
put the legs back to normal.
What was that?
Maybe just put the legs back to normal, because when they're turned like that, it just feels
Yeah, if you feel
it's-
like if you're able to do the movement just with that simple adjustment, then that's awesome. So.
Okay.
Yeah. So, does that make sense about the gradual exposure? So, same idea applies like we were talking about with coning. If you see something if you have a movement where you are experiencing coning or doming, you won't want to avoid it completely. You want to find a movement that's similar, but where you're managing the pressure. And you can do that and train that, and then you gradually progress. So, all of those
options.
Yeah, it's great source for modifications. So, any other questions about anything?
Oh, that's good.
So is this ever gonna become like muscle memory, like your body's
Yes.
just gonna do it automatically?
100%.
And how many
That's
times
the
can we
goal.
relearn it after we have kids? Cause I'm not done having kids.
Yeah.
Is this always
keep
gonna happen
practicing.
every single time?
It depends on, like, yes, but you can also do a lot during pregnancy so that the window of change isn't as long.
I was gonna,
That delicious.
on that, I was gonna say, like, so my first 3 pregnancies, I didn't work out at all during, and I can tell you my pelvic floor was a lot worse off on those. And then my 4th pregnancy, I was here working out, and I can't even say I like specifically did any like pelvic
Yeah,
floor stuff,
just
but
keeping
just
your training.
keeping that strength up helps. So like I think if during your pregnancies you kept up on like the exercise, you'd be a lot better off. Like it shouldn't
For
be
sure.
as bad as the first time.
You'll heal faster too.
Yeah.
Cool. Y'all are awesome. Any other questions?
I did have one more question.
Yeah.
So tell me about, like all the tools. 'Cause there's tools that you can buy that they say, and I haven't tried them, and I don't have any, but I'm like in the market.
Like the game
Yeah, like they have like
I've
those
seen those
poise
too.
things that they're like little tampons that you can put in
practice
that like,
Stimulates the.
I don't think it's, I think it just blocks. It expands and probably closes off your urethra. I don't know how it works, but I'm just saying they have these little, it's like a tampon and they have different sizes, and I think you put it in and it's like a little tent and it closes off your urethra. So there's that. They have like little suction, like little cone, like little, like something you can just,
like the pads you can.
this
put
is to
in up
prevent it,
against
yeah. So then they have stuff that you can put like a little sticker on your urethra so nothing comes out. Like, I don't know, I'm just asking, you're
Yeah.
That reminds me of KT tape.
yeah, something like when I put KT tape from head to toe.
Yeah.
I gotta tape up.
Oh my god.
Straddle up.
So anyways, and then like I've seen like little like, they look like dildos, but I don't like
Yeah.
things like
I've heard
that
of
that
those
you
too.
can use to
They're
practice
like
with.
a game, like you get like a game and you squeeze it and it's like,
Yeah.
Oh.
is that what you're?
I don't know. It
Oh,
just
there's
looks
a
like
game?
a
Like a
dildo. Yeah, I didn't know it came with
There-
cards
there's-
and dice, but
There's ones I've seen that, yeah, it's like something you stick up there.
yeah.
And then there's like a game that like,
Oh.
as you're squeezing it does something with the game.
Oh my.
Like
I've
a
seen ads
dopamine hit.
for it.
Okay, anyways, there's things like that. So
Yeah.
like, do you?
So there are things
When
like,
you get- when
it
you get
sounds
it that
similar to
level.
like a biofeedback where you can kind of get a feel for, is it contracting, like what it's doing? But I haven't heard of those things outside of clinic. I've only heard of that clinically. Like you have little electrodes that you like put on, and then it like detects the electrical activity. But I know like they're kind of rare, but some OBs will fit for like a pessary, and that's a device that can help you to keep working out while you continue to train if it's to that point. So those are kind of the more options, like tools, I guess, that I'm aware of. I don't know about all of those ones on the market, if that makes
The
sense.
stickers,
More
you're not
clinically is
familiar
my
with those
knowledge.
little stickers.
No, I'm more, mine is
You
more.
guys ever went and got a coffee and they put that
Is it
little
a
sticker
scratch
on
and
the top
stuff?
of the hole?
Yeah.
Okay, so one more inappropriate question, and I just came out. I just forgot it. Hold on, it'll come back to me in a second. I don't know all those things.
Any other questions while she thinks? Cool. Clear as mud. Hopefully this is helpful.
Like
it
having
was
shock
super
therapy
helpful,
to
thank you.
your knee or something, where they, you know what I mean? They put the little things and they
Oh,
shock you.
medication.
Yeah.
So I used to give my dog medication when she would have urinary leakage when she was older, and I'm pretty sure that we can do that.
Did you save the prescription?
No, no. I'm just like starting my research right now.
Yeah, so it would,
Anyways, do you treat like a lot of people with like medication that is helpful? I'm not sure.
I think that you would kind of need to dive into more like what is the type of incontinence that's occurring. Like, do you have incontinence going on other than stress incontinence? Because stress incontinence is very much mechanical, I guess you can say, versus chemical, unless you're, for whatever reason, not generating contractions throughout your body. Like if you're, I don't anticipate that's the case, but I'm not aware of any like specific medications that are helpful for stress incontinence. But
Okay.
Does a
Doesn't mean-
hysterectomy change anything? Cause
What
there's
was
not
that?
that space there anymore. Does a hysterectomy change anything?
Good question.
Cause the bladder slats, they said that it
Yeah.
was sad cause there's not space there that should have been there.
I'd imagine it could, but I don't know off the top of my head. That was not something that I've been told or read in the research as like a major factor. But I'm not gonna say that it's not. Any other questions? Sorry, I know we kinda went over, but.
Well, clearly we have a lot of questions.
Yeah. Okay, well, thanks so much. I do have like, if you are needing like a consult, I have cards if you want a consult, to talk about if you feel like if we feel like you would benefit from treatment. That's kind of just more of a conversation. There's no testing or anything involved, but, if you want those, then you can take those and do as you want, but you can use them for anything else too, if you have orthopedic stuff going on, so, yeah.
I've given
Thank
all the
you.
cards out, so I need.
Let me,
Oh,
let me grab
okay.
those.
Thank you.
You can turn that off, thank you.